This is module number 2 for human gross anatomy, and it is intended to serve as an introduction to clinically oriented anatomy. Before viewing this module, you should have completed module number 1, which served as an introduction to anatomical terminology. After completing this module, you should be able to describe the levels of organization of living systems. You should also have a basic understanding and be able to communicate this understanding of the different organ systems within the human body and their structures and functions. And you should appreciate that a comprehensive understanding of human gross anatomy is also inclusive of surface anatomy, regional anatomy, system anatomy, clinical anatomy, as well as radiology and embryology. The levels of organization in living systems range from the molecular level to the organismal level or organism. At the molecular level, we have atoms and molecules, and some of the important atoms in living systems include carbon, hydrogen, and oxygen, and some important molecules include water, lipids, proteins, carbohydrates, etc. Atoms and molecules combine together at the cellular level to form the cell, which is the functional living unit in the human body. Similar cells come together to serve a specific function or specific functions. This is what is known as the tissue level. And when different tissues combine, 2 or more of them, to form a system that performs complex functions, we refer to this as an organ or the organ level. Multiple organs can work together to achieve a common function. This is the organ system level. And then when all organ systems combine, this is referred to as the organism or the organismal level. The cell, of course, is the smallest structural and functional unit of a living organism. It is formed from atoms and molecules as well as organelles. They are typically microscopic and consist of cytoplasm and a nucleus enclosed in a membrane, and they come in many different shapes and sizes, such as red blood cells, abnormal cells, such as adenocarcinoma cells of the breast, nerve cells, and the nerve cells pictured here are Purkinje fibers in the cerebellum. And this last image is a stained or fluorescent image of fibroblast cells. Fibroblasts create connective tissue. Again, a tissue consists of a group of similar cells that come together to form specific functions in the body. And there are 4 main types of tissues within human organisms. This includes epithelial tissue, and epithelial tissues cover the surface of the body or line body cavities. They also form important organs and glands. Connective tissue. This is the sort of tissue that binds structures together within the body. Muscle tissue helps move the skeleton, or it helps move materials through organs such as the gut tube. And then nervous tissue. This is composed of neurons, the cells that transmit and receive nerve impulses, as well as supportive cells that help protect neurons, known as glial cells. Pictured on the right here is a type of epithelial tissue, transitional epithelium, then compact bone, a connective tissue. In the third image, this is cardiac muscle, and in the fourth image, the neuron. As previously stated, organs are composed of 2 or more tissue types, and these tissues come together to form a common function or a common group of functions. Typically, an organ is a part of an organism that is self-contained and has vital functions. Here we see the heart and the human liver. An organ system, again, is a group of organs that work together to perform one or more functions. And in the human organism, there are a total of 11 organ systems. And these include the integumentary system, or skin, the skeletal system, the articular system of joints in the body, the muscular system, the nervous system, the circulatory system, which consists both of a cardiovascular component and a lymphatic component, the digestive system, the respiratory system, the urinary system, the reproductive system, and the endocrine system. And it is interesting that organs can be associated with more than one organ system. An example of this would be the male urethra, which is also in two organ systems, including the urinary system and the reproductive system, or the pancreas, which is both digestive and endocrine, and the heart, which is both endocrine and cardiovascular. The integumentary system is composed of skin, or integument, as well as associated appendages. These include nails, hair, sweat glands, and blood vessels. There is also subcutaneous tissue, or fat, within the integumentary system. If taken away or out of the body, it composes the largest organ of the human body, and it has various functions, including protection, sensory-reception, thermoregulation, excretion, and vitamin D synthesis. When we look at the skeletal system, we have a system composed of bones, cartilage, and some associated blood vessels and nerves. There are 206 bones in the adult skeleton that can be divided into 80 axial bones, okay, and 126 appendicular bones. The functions include providing shape for the body, as well as support and protection. The skeleton allows for movement when acted upon by the muscular system, hematopoiesis, mineral and energy storage, and the bones can be classified as being long, short, flat, or irregular. Here, for example, we're looking at a long bone, and this bone happens to be the humerus. A long bone is composed of a diaphysis or shaft and two rounded bone ends, a proximal epiphysis and a distal epiphysis. The diaphysis is composed of compact bone, whereas in the epiphyses, okay, there is found to be spongy bone. The diaphysis also has a medullary cavity that contains a yellow bone marrow in adults, whereas the cavities in the spongy bone contain red bone marrow or hematopoietic tissue, okay, located mainly in the epiphyses of the femur and the humerus. Okay. Bone also has an extensive blood and nerve supply, as well as articular cartilage on the ends for articulation at joints. This then brings us to the articular system, or the system that consists of joints, as well as the associated ligaments that hold the joints together. The function is to connect the bony parts of the skeletal system, but it provides for movement across these sites. There are various types of joints, such as fibrous joints that contain fibrous connective tissue, cartilaginous joints that contain cartilage and allow little movement. There are two types of cartilaginous joints, synchondroses and symphyses. And then we have synovial joints. These are very complex joints, and they have a space or synovial cavity that is filled with fluid and also lined by a membrane that contains cells that secrete this fluid. Based on function, joints can be classified as synarthroses, amphiarthroses, and diarthroses. Synarthroses are immovable joints in which the two bones are connected rigidly by a fibrous connective tissue. Amphiarthroses are slightly movable, where the surfaces of the bones are connected by ligaments or cartilage, and diarthroses are joints that are freely movable in various planes. The muscular system is composed of muscles, as well as the connective tissue wrappings of the muscles, and the tendons that connect the muscles to the bones. It functions to move or position parts of the skeleton or the body. Also, in thermal regulation, when muscles contract, they produce heat. Propulsion or expulsion, actually, this is the control of fluid or other material contained within a lumen, and this is a function that is characteristic of smooth or cardiac muscle. Muscles also help to close off openings. In other words, they act as sphincters, such as the anal sphincter. And skeletal muscles also attach to bone. Muscles also have somewhat of a complex naming system. They can be named in several ways, such as being described by the muscle action or the specific region of the body in which they course over. Some muscle names use the muscle attachments as part of their descriptions, as well as the orientation of muscle fibers. And then the muscle shape and size also plays a role, as well as the number of heads. There's also some other terminology that we need to be aware of when we look at the muscular system. And three terms that need to be distinguished are tendon, aponeurosis, and ligament. A tendon is composed of dense, regular connective tissue, and it attaches muscle to bone. Some tendons are very flattened and very broad, almost sheet-like. These are known as aponeuroses. And then the ligament. Ligament is also composed of dense, regular connective tissue. However, ligaments attach bone to bone. There are also many different kinds of fascia throughout the body. Here are two examples, the superficial fascia and the deep fascia. Superficial fascia is known as the subcutaneous layer or hypodermis. It is composed of areolar and adipose connective tissue. So this superficial fascia is then deep to the integument, but superficial to the deep fascia, which surrounds muscles, and it may contain a variable amount of fat. In contrast, deep fascia, which is also composed of dense connective tissue, it surrounds muscle groups, fascicles, which are groups of muscle fibers, and individual skeletal muscle fibers or cells. It also has connective tissue wrappings such as endomysium, perimysium. All of these are parts of deep fascia. Deep fascia is deep to the superficial fascia and is named in some parts of the body, such as thoracolumbar fascia. Here we see examples of fascia. On the left, we see superficial fascia. It is deep to the skin. Okay. In the middle image, we see the integument, and the superficial fascia has been dissected. And then we see some deep fascia. Deeper dissection reveals the thoracolumbar fascia, or the deep fascia. This is shown on the right. The circulatory system consists of two systems, the cardiovascular system and the lymphatic system, and both function in parallel to transport body fluids. Let's look at the cardiovascular system first. It is composed of the heart, the blood vessels, and of course the blood. The heart is a pump, and it pumps blood throughout the body and through vessels of the body. The blood vessels carry the blood to and from the heart, the lungs, and other organs within the body. The blood is an essential component of the cardiovascular system. It carries blood cells, hormones, nutrients, as well as respiratory gases such as oxygen and carbon dioxide, and it picks up waste products from the distal parts of the body and returns them to areas where they can be properly eliminated. There are various types of blood vessels, and these include arteries, veins, and capillaries. Arteries transport blood away from the heart and typically carry high concentrations of oxygen. An exception to this are the pulmonary arteries. They have higher blood pressure than veins, smaller lumens, and thicker walls. Veins transport blood to or toward the heart and are typically low in oxygen but high in carbon dioxide. Again, the exception here are pulmonary veins. Veins typically have low blood pressure, and they often need valves to prevent backflow of blood. They have larger lumens, and their wall thickness is thinner than that of arteries. Then we have the capillary network. These are the smallest of vessels. And within the capillary network, this is the area in which there is gas exchange and nutrient exchange between the blood and the tissues. Structures of the artery, layers of the veins, and the capillary network. And this is how an artery would look under the microscope, histologically, and a vein. Within the cardiovascular system, we can also speak about a pulmonary circulation versus a systemic circulation. Looking at the pulmonary circulation, this is the system that transports blood between or to and from the heart and lungs. Once in the lung, CO2 is given off from the blood and the blood is reoxygenated. And the CO2, of course, is expelled from the lungs through the act of respiration. This is in contrast to the systemic circulation. This transports the blood between the heart and the rest of the body. And of course, at the capillary level, oxygen and nutrients are transported to the tissues, and CO2 and other waste products are removed. We can't forget about that part of the cardiovascular system that is called the lymphatic system, and it also is composed of vessels, ducts, as well as structures known as lymph nodes, and there are a variety of lymph nodes throughout the body, and they are often named based on where they reside in the body, and of course some lymphatic organs. The functions of the lymphatic system are primarily to transport and filter lymph or interstitial fluid that is picked up by the lymph vessels. And also, the system is capable of initiating an immune response to pathogens that are found within lymph. There is also a hierarchy of lymph vessels, and this includes the lymphatic capillaries, which are the smallest lymph vessels associated with blood capillaries. Becoming larger, the structures become lymphatic vessels. These connect to lymph nodes, which filter the lymph. These join and form lymphatic trunks. So these are the merging of larger lymphatic vessels. And to final structures known as lymphatic ducts. And these ducts drain the lymph back into the bloodstream. This image shows you an example of the lymphatic capillary network as it intertwines with the cardiovascular capillary network. Typically, the lymph capillaries are larger in diameter than blood vessels, and they have one-way flaps that allow interstitial fluid to enter but prevent it from leaving. And when fluid enters the lymphatic capillary, the fluid is renamed lymph. Lymphatic vessels typically represent a very low pressure system, and they have valves to prevent backflow of the lymph that they contain. They take lymph to and from lymph nodes for filtering, and lymph nodes have leukocytes within them, which will be activated if something foreign is detected within the lymph. Lymphatic trunks are formed from the merging of lymphatic vessels. These include the intestinal trunk, the left lumbar trunk, as well as the right lumbar trunk, and the right bronchomediastinal trunk, and the left bronchomediastinal trunk. There are also the right subclavian trunk and the right jugular trunk. These trunks combine to form one of two ducts. These are known as the thoracic duct and the right lymphatic duct. The right lymphatic duct drains the right side of the body, inclusive of the head, the thorax, and the right upper extremity, whereas the thoracic duct drains everywhere else. Both ducts drain into a junction between the subclavian vein and the internal jugular vein. There are also other structures that are within the lymphatic system. These include lymphatic structures and lymphatic organs. Lymphatic nodules that are not completely surrounded by a connective tissue capsule include MALT, or mucus-associated lymphatic tissue, typically found in the lining of the GI tract, the gastrointestinal tract, the respiratory, genital, and urinary tracts. There are also tonsils, such as the palatine, pharyngeal, lingual, and tubal, and these structures provide the first line of defense against ingested food, drink, or inhaled air. Lymphatic organs are completely surrounded by a connective tissue capsule and include lymph nodes, thymus, and spleen. The digestive system includes that system of organs that not only ingest food and fluid, but break it down into smaller components so that these components can be absorbed into the bloodstream and transported throughout the body. It also expels waste products such as fecal matter. The digestive organs, or GI tract, really consists of a long tube from mouth to anus, as well as accessory organs such as the liver, gallbladder, and pancreas. These organs are actually not part of the GI tube, but assist with the process of digestion. The respiratory system is composed of the nose and nasal cavities, as well as the paranasal sinuses, the pharynx or throat, larynx or voice box, and the trachea, the bronchial tree and bronchioles, and the lungs and diaphragm. The upper respiratory system consists of all the structures from nose into pharynx, okay? And the lower respiratory system from the larynx through the lungs. The respiratory system serves several functions, including conditioning. It conditions the air. It warms it, filters it, and it humidifies the air. It also functions in gas exchange. Also in phonation, the production of sound, and it has a role in olfaction or smell in the superior portion of the nasal cavity. Urology is that branch of clinical medicine that deals with the urinary system, and the urinary system consists of a variety of bilateral or paired structures as well as some midline components. These include the kidneys, the ureters, the urinary bladder, and the urethra. It functions in terms of filtering blood, removing waste products, etc., and it turns the filtrate into urine. The urinary system also stores and excretes urine, helps to control vascular volume, and also assists in regulating blood pressure. It also has a role in endocrinology for making red blood cells through a component or a hormone known as erythropoietin. The reproductive system consists of primary sex organs. These are known as gonads or ovaries in the female and testes in the male. There are also accessory reproductive organs that assist with transporting and housing sex cells. In the male, the urinary system and the reproductive system are linked embryologically. Gonads produce the sex cells or gametes as well as sex hormones. These include androgens in males and estrogen and progesterone in females. Finally, the endocrine system consists of specialized structures that secrete hormones and includes a number of structures located throughout the body, such as endocrine glands, clusters of cells within blood vessel walls and the gut tube, as well as specialized nerve endings. Hormones are organic molecules, and these are carried by the circulatory system to distant effector cells or targets in all parts of the body. And hormones will influence metabolism, menstrual cycle, pregnancy, as well as a variety of other processes. Let's discuss a few last things about studying anatomy. First of all, you should understand and appreciate that anatomy is really the study of the structure of the human body, and it can be further classified into regional anatomy that consists of the body as organized into segments or parts, as well as systemic anatomy, which views the body as organized into organ systems. Surface anatomy provides information about structures that can be observed or palpated beneath the skin or integument, and radiographic or sectional and endoscopic anatomy allows us to appreciate and view structures within living systems without creating an incision through the body wall. And clinical anatomy emphasizes the application of anatomical knowledge to the practice of medicine. We can't forget about embryology, and embryology is that discipline or subdiscipline of anatomy that studies the development of an organism before birth, as well as the congenital disorders that occur during development. Critically, an understanding of human embryology greatly enhances understanding of human anatomy. We should also appreciate that within any dissected region of the body, there may be portions of many organ systems. And you cannot forget the patient. Your anatomical donor, your cadaver is your first patient. The first patient is a great gift of self, and it is your responsibility, your obligation to utilize this gift of self, to respect it and appreciate it. And the best way you honor your first patient, your anatomical donor, is to learn all that you can learn through anatomical dissection. Also, it is important to understand both the regional anatomy as well as the systems-based anatomy, and to recognize when organ systems share functions and or organs. Before you continue your study of human gross anatomy, I encourage you to view Introduction to Medical Imaging. This is the first of the radiology modules in this course.